Hello everyone, I am Dietitian Rupal here from Mumbai, India, and as promised, I am doing a Facebook Live today to tell you all more about how it is working as a dietitian in India. I will be waiting for 2 more minutes for people to join in. Yeah. Okay, so here I start. I will just give you a brief introduction about me. My name is Dietitian Rupal here, and I'm practicing as a dietitian, clinical dietitian in Mumbai, India, and I have completed my master's in foods, nutrition, and dietetics. And after completing my graduation and master's, I decided to opt for doing a certified diabetes educator course. I have done that from Project Hope, that is recognized by International Diabetes Federation. And after completing my studies, basically I started my work as a clinical dietitian with one of the hospitals in Mumbai. It was a super specialty hospital, and currently I am more into my private practice. You can connect with me over my social media pages, that is on Facebook, Instagram, and Twitter, under the name of Eat Right with Rupal. So firstly, I can see many people joining here. Firstly, I would like to thank the admin of Build Up Dietitians for inviting me over here to discuss more about how it is being a dietitian in India. What are the opportunities we get over here? What is the basic qualification that is needed for practicing as a dietitian in India? And what are the challenges that we face mainly over in India to practice as a dietitian? Okay, so main thing, if you have any questions while doing a live, you can post it. I will reply to that as soon as possible. Do participate and let me know if you have anything coming up in your mind regarding India, regarding the practice, or anything as such. Okay, so here I start. Basically, I have done my master's. So during my master's, we had a subjects right from human nutrition to clinical nutrition to sports nutrition, as well as biochemistry, and we did had food practicals as well, wherein we were taught how to standardize the recipes, as well as how to basically make the diet more tasty, even when we are restricting so many foods, so many sodium, so many other electrolytes, sodium and everything. Still, we have to make it tasty. So that's what we had kept in mind while studying right from that time itself. And I have done my master's from Mumbai University. It's a state university in India. And after completing the masters, I also did gave my entrance exam, which is very much needed if you want to work as a professor anytime in India. So I did give, but I am not working as a professor. I am still working as a clinical dietitian itself. So that is a basic qualification that I had done in my done up till now. And if you wish to know what is the basic qualification that is needed to practice as a dietitian in India, then yes, first thing is the bachelor's. BSc is what is needed. That is a basic degree without which you can't be called as a dietitian, not as a qualified dietitian. And after completing the bachelor's, you have two options. Either a student can do postgraduate diploma, or they can do masters, which is again a 2-year course, and postgraduate diploma is basically a year course. And recently there has been started multiple specializations in masters as well as postgraduate diploma. Before it was not there. From last few years, maybe 5 to 6 years, we have started over here with that as well. So students are doing masters, but not in a general nutrition, but they are doing masters specifically in the area of their interest. So maybe they are doing in either just sports nutrition, masters in clinical nutrition, or even there are diploma in oncology nutrition, diploma in renal nutrition, and many others like that. So that is what a recent progress has been done in India regarding the education and training. There is a registered dietitian quality mark, you can see, which has been given by an Indian Dietetic Association to the students who complete said period of internship, which is usually 6 months of internship after completing their masters under a registered dietitian. And after that, if they are able to pass the examination, which is again very strict, so if they pass the examination, it is they are qualified as a registered dietitian. However, the tag of registered dietitian is not made mandatory in India. A student without an RD can also practice. Only thing is, if a student have a registered dietitian as a tag, it's more of a quality mark. It makes this person or the recruiter aware that they are more in-depth aware of all the nutrition and clinical knowledge rather than a dietitian apart from an RD. And efforts are being made by Indian Dietetic Association to make it more suitable for everyone to do the RD and make it more as a compulsion rather than just as an option. So that is about the education scenario in India. If you have any questions, anyone regarding anything regarding the education qualification or the training or the courses, you can put me down. I will be happy to answer over here. Okay, so that was all about the education and qualification about the dietitians in India. That is very much needed. We have two national bodies, the two major bodies, I can say. There are multiple small bodies as well, but the two major national associations are Indian Dietetic Association and Nutrition Society of India, which is mainly governing the dietitians in India. So that is the one thing which is that these two bodies are very much active in India and trying every day to do something better for the working dietitians in India. Okay, then comes the role and prestige of dietitian in India. So if I see the few years back picture, then obviously the prestige of dietitian was not that good because people were not much aware of something called as dietitian in India, or even the dietitian, the students who used to take dietitian as a field were very less. But then obviously with more of education, the demand of a dietitian is increasing. The picture has changed. There are doctors, physicians who are getting trained internationally and coming back and practicing here and not talking anything about a diet, but just simply referring to a dietitian for handling any queries related to diet. So that is actually a very good picture and scenario that we are able to see now in India as well. And obviously previously there was in India that children's were not getting educated into and getting a professional degree, but then they usually do the basic education and join the forefathers business. So the education level was low, and because of that, the same reason, the awareness about being a dietitian was not much. But then with education actually comes the knowledge that there is also a need of a dietitian in India, and we need to consult a specialist for concerning anything regarding the diet and foods. So that is one thing. Second thing, if you ask about the job opportunities, it is increasing day by day. Previously, there were only clinical dietitians which were there practicing majorly as a dietitian in India, but now the scope has increased. Dietitians who are specializing in sports nutrition are going and actually improving the physique of the athletes, sports people, sports person, even the models, actors, actresses are the ones who are actually consulting a dietitian now. So dietitian in the hospital basically work on the assessment part. They basically start with if a clinical dietitian basically start by taking a subjective global assessment of all the patients admitted in the hospital. Followed by that, they do an in-depth and anthropometric measurements, so height, body weight, and if needed, they check the fat mass by the calipers and waist circumference and many other things. Then comes the biochemical parameters that is always checked before prescribing a diet. Then then dietitian checks the clinical deficiencies, signs and symptoms that is seen on admission. And they take dietitian always takes a diet recall before admission, how the diet or appetite of the patient was, and based on all these parameters, a dietitian prescribes a medical nutrition therapy which is to be followed by a patient on discharge. And during the stay, dietitian consults or dietitian speaks to the kitchen or canteen staff on what kind of diet will be given to each and every patient admitted in the hospital based on the parameters. So it is very much systematic now. Clinical dietitian is practicing on a very much a set protocol, and that is why the need of dietitian is increasing. I can hardly see any hospitals in India, especially in the cities that where the doctors are not hiring dietitians. It is now like not mandatory, but then each and every, even the small nursing homes have started hiring a dietitian in their hospital, because they understand the importance, and dietitians in India are doing the best job to make them seen and put forth their whole effort in increasing the awareness among all. So that is everything about the clinical dietitian. There is as well as also there is inpatient and outpatient dietitian. So both the dietitian handles both follow-ups as well. Second comes the community nutrition, community dietitian. So we have many ongoing nutrition schemes basically to improve the malnutrition scenario in the country, both undernutrition as well as overnutrition. So some of the scheme name, if I tell you, it's like ICDS, that is Integrated Child Development Scheme. That is midday meal scheme, wherein they provide a nutritious meal to each and every child who is coming to the school. And this has all been planned by a dietitian working in a community sector. Plus, there are international organizations like UNICEF who are hiring dietitians to plan and formulate what needs to be done in terms of improving the nutrition status of the country. Third comes the dietitian in the sports and gym industry. So this is increasing. Obviously, the trainers are the big competitors over here. We can't say them as a competitors, but then till a few years back, it was the trainers who were used to giving the diet to all the members. But now gym owners understand that it is important to keep a dietitian so that they can give an evidence-based knowledge rather than just giving diet like keto or paleo or vegan or anything. So a dietitian understands what is the body type. They do an in-body, most of the gym have in-body machine, so wherein they are able to check the body composition, how much is the body fat, body muscles, and water weight and everything. And based on that, a dietitian prescribes a plan that needs to be followed, and there is a periodic follow-up as well for the same. So that is mainly a dietitian working in the gym and sports sector. And also it is very much you can say a growing field, because the number of people who are overweight is also increasing day by day. So India is a country where there is both undernutrition and equal number of people who are suffering from overnutrition. So both type of malnutrition exist in India. So the need of gym and the fitness as well. And greatly, there are many who have started working out on a regular basis, understanding the importance of physical activity, and that's why the dietitian role plays a very big importance over here in the gym sector as well. Then comes the dietitians in research and teaching area. So here, most of the dietitians who have completed their masters and PhD opt for going into a teaching profession or research profession, which is very much again a booming field, because many researches have been started to be taking up. Previously, documentation was not taken as a very serious part in India, but now the awareness is increasing. There are so many dietitians and physicians are asking to start putting a documentation of whatever they are doing and putting and publishing it as a research. So there comes a need of dietitian in the research and teaching area as well. So we can see a majority of them, but then there is a prerequisite of giving an entrance exam, whether you want to go into a professor job or you want to opt for a PhD. So that is what is very much required before starting to do or go into any research sector. Then comes a dietitian playing a big role in food product development. With urbanization, westernization taking over in India, the requirement of healthy food has increased in India. So people are actually wanting to eat healthy food, but then the availability is a question mark. So again, dietitian has started going in this field, and they have started actually developing a product, protein bars and many other healthy food stuff, marketing it as a protein supplements and nutrient dense supplements and ready to eat foods, basically, so that person is not going and opting for the junk foods or the unhealthy foods. So that is where a dietitian has started coming in a big way, and obviously the demand is increasing over there, because dietitian is the right person, whether they want to make the food healthy and as well as tasty as well. So I'm sure there will be no other person or no other qualified person more than a dietitian who can develop a product well than this. So dietitian is going in this field as well. And plus, yes, along with the healthy food products demand that is increasing, there are many errors which has been seen while marketing the products. So marketing gimmicks is very much common in India, wherein the food production owners put the title or the you can say market the product in such a way which is actually not correct. So that is again where a dietitian has to teach the masses regarding what is right and how you have to actually see the nutrition label, because not all masses are aware that how to read the nutrition label. It's just they see and they leave it. So that is where again an additional responsibility has started coming in on dietitian. So that is one thing. Then more number of dietitians are now opting for private practice, because in India, as the demand has increased, obviously the private practice need for private practice has increased. Previously, it was like a clinic very far away of a dietitian. From one clinic to another, it's like a big distances there. Now you can see in like within 15 to 20 minutes of distance, there are clinics, dietitian clinics opening up and running very well. Obviously, a qualified dietitian clinic. I will not talk about quacks right now, but there is increasing number of quacks as well. So the private practice is basically seeing the clients on one-to-one basis and prescribing a medical nutrition therapy based on their parameters and everything. Then comes a dietitian's role in corporates. This is also a field which was not there before in such a huge number, but then huge number of dietitians are now getting regulated by corporates like IT company or bank bank for bank. So majority of the dietitians are opting for that as a career, and they are happy to serve as a dietitian, wherein they basically change the canteen menu to from unhealthy one to a healthy one. They play around the, we can say, the structure or the interior of the workplace, wherein they try to make it more healthy or remind them of a healthy food around them, so that they, you know, whenever they get free by seeing that picture, they are opting for a healthy food kind of thing. So that is also something very much in demand. Two, three major fields that I feel that is very developed in other countries like US and other like Europe, but then is not being that developed in India is one is supermarket dietitian. We are not seeing a huge rise in the supermarket dietitian in India. So because I guess not many dietitians are aware of this as a field, one thing. And second thing, not many supermarkets are keeping a dietitian or hiring a dietitian. So that is one sector wherein dietitian in India has to work to start getting into supermarkets as well. And second is the dietitians in Army and Navy. So it's not that there is no dietitian in supermarket or in this field, but then very few number of dietitians are part of this field. So that is what needs to be worked on. And these are the major job opportunities that the dietitians in India are getting. So if anyone have any questions regarding the job opportunities, what is the qualification that is being required, please do write it up. I will be happy to answer again. Okay, so that was all about that. Then comes the food challenges or the dietitian challenges that dietitian faces in India. India is a country, India is a diverse country. So it has different, very many religions, cultures, languages that they speak, so, and multiple states. So each state has its own, so India has like 29 states. So each state has its own particular culture, religion that is they are following, food habits that they are following, and each state varies from another state to a great extent. So practicing as a dietitian in India mainly requires that a person has to have a knowledge of all the different region and the food practices. Otherwise, and yeah, there is a lot of migration as well. So if a dietitian in South India is seeing a North Indian client, then they have to prescribe a diet according to the North India. Otherwise, the client will not be able to stick to that. So, and main thing, they have to have a knowledge about that. So that is what is a very big challenge. But then dietitians are very well learning about that right from the starting years, and it's not it's becoming easier for us to actually starting to prescribe the diet. And obviously the languages, there are, though English and Hindi are the major official languages, but then there are almost 14 languages that has been there. And it's not for the younger generation, but for the older generation, again, the communication becomes a problem. So that is one of the challenge that we face over here. And the other main challenge that we face in India is a very high carbohydrate eating country. So whether you say North Indian or South Indian or any part of the India you take, carbohydrate is the main part of the meal. So whether you take it as a wheat cereal based flat bread that has been commonly eaten over here, or you take rice, this both are the things which is very much commonly taken as a staple food in India by all the different states. So what is very much important over here to decrease the content of carbohydrate in the diet, because vegetables, or if you say the dairy products, or you say the meat or the non-veg, are acting as a side dishes. So main thing is the cereal base, and then the vegetables and other dairy products are taken as a side dishes. So even the one who are eating non-vegetarians in India, like non-veg, like chicken or fish in India, are not a very high frequency of eating the non-veg is very less even among the non-vegetarians. So the protein consumption to some extent is less in India, not up to the mark. Not all, not a generalized, not to all, but the majority of them. And even the dairy products, the consumption is not that high. So majority of them have chapati, that is with wheat bread, or you can say cereal based bread. It is a flat bread and with the vegetables. So this is both as a carbohydrates. That is one thing. So people needs to be made understand the importance of adding protein in each and every meal. Fiber is something that is not much added in the meals. So even when the person eats salad, it's like not in a great quantity. It's very less quantity. If you talk about fruit is many varieties of fruits are available in India, but the amount of fruits taken by people are very less. Maybe once in 2 days. The reason for that can be either it is too expensive, or second reason can be it's the people don't have that habit of eating at least 2 to 3 fruits in a day. So that is the two reasons why people are not eating more fruits. It's expensive as compared to easily available other junk foods, which is very much cheaper. So that is one thing. Second, the main challenges that we face is the rise of a number of unqualified dietitian, or you can say nutrition quacks. With the rise in the nutrition awareness and the need of a dietitian, yes, the number of nutrition quacks has also increased. The self-proclaimed dietitians, you can say, is increased, wherein without any knowledge or anything, they are just simply prescribing diets. So that is the reason why the diets like keto and paleo and other kinds of diet have been increased, have been followed more in India as well, because thanks to all the unqualified people who have started prescribing keto to any people who want to lose weight and all. So that is one thing. Westernization has come a long way in India. So the number of people, especially the people living in the cities, opting for burgers, pizza is increasing. And as we know, the research says that this all foods are very addictive. Previously, there was a trend where a female, a housewife, you can say, was used to make home cooked food and serve the family. But now the scenario has changed. Majority of the people, especially in the cities, are both the couple is working. So home cooked food has become decreased from before, and the reason why the people have started opting more for this easily available foods and all the junk as well. So that is again a big challenge. So we need to make them understand how and what you need to actually start making something easily, how you can make something easy and tasty and yet faster. So that is where a dietitian plays a big role over here as well. So that was all about the challenges that we face. The another challenge that we face is India has many economic layers. So middle class family to low socioeconomic status family to higher economic status family. So again, the diet varies according to that. When prescribing a diet, we need to very much know about the status of the family, from what background they are coming, and based on that only we can actually plan the diet. So this was all about the challenges we face as a dietitian in India. Is there any questions from anyone that I can answer for you? Anything about India? I will be happy to answer that if anyone have. I can see any comments right now. Okay. Uh, No problem. So even if you don't have any questions right now, that is all fine. You can, I have given you my social media pages name. You can connect with me over there anytime. I will be happy to answer any questions if you have regarding India. Again, I will repeat once. It's Eat Right with Rupal. I'm there on Facebook, Twitter, as well as on Instagram. So you can let me know any questions if you have. Thank you so much. It was nice Facebook Live.